Hello, good afternoon. My name is Nigel Maynard. I am the editorial director of Drugstore News. And welcome back to our ongoing series where we interview thought leaders in the retail pharmacy space. Our guest today is Scott Guisinger. He is the Vice President of Pharmacy for Price Chopper. Scott, how are you?
I'm doing well, Nigel. Glad to be here and excited for our conversation today.
Glad to have you. Can you first give us a brief history of Price Chopper?
Certainly, yeah. So we operate 77 Price Chopper and Market 32 pharmacies throughout New York, Massachusetts, Connecticut, Pennsylvania, Vermont, and New Hampshire, which is inclusive also of our central fill and specialty pharmacy operation. And we're headquartered in Schenectady, New York.
Okay. Now you bill yourself as a complete health and wellness destination. Can you tell us about your patient-facing services?
Yeah, certainly. So, we recognize that patients, visit their community pharmacies 2 to 3 times or more than their primary care physicians. And, pharmacists continue to be one of the most trusted healthcare professionals, healthcare experts in people's day-to-day lives. So, the role of community pharmacies and the pharmacist in the delivery of preventative care and chronic disease management continues to expand. Essentially our pharmacies are serving as healthcare hubs in our communities, and Price Chopper Market 32 pharmacies are really rising to the challenge and providing much more than prescription filling. Our pharmacists and our pharmacies are providing immunizations, medication therapy management, chronic disease management, medication adherence monitoring, point of care testing, and in more recent times, we've been, supporting COVID-19 testing as well as, COVID-19 vaccinations. And obviously this is just in addition to our regular medication therapy interventions and ongoing in-depth counseling that our pharmacists are providing. So, and then I'd also add that our specialty pharmacy is dedicated to serving patients with chronic and complex disease conditions. And, we're really providing these patients with the specialized medications and ancillary services and support that they need to navigate the complex world of the specialty medication landscape.
Mm-hmm. So how have you noticing that your customer needs are changing, and how are you responding to them?
Yeah, I think that patients and customers are looking for more convenient ways to manage their medications on the go, and are really looking for solutions for their entire pharmacy services, as well as being able to manage medication therapy for their family and extended family. So, we actually offer a pharmacy mobile application that does provide a family care option, really allows caregivers to manage refills for the entire family. It could include elderly patients, spouses, children, and even pets. So patients, are really continuing to become more comfortable receiving various forms of their healthcare treatment from community pharmacies. And, this has created a really good opportunity for Price Chopper Market 32 to collaborate and develop partnerships with other healthcare providers, really allowing our pharmacies and our pharmacists to act as an extension of the healthcare team and provide more convenient community access points to provide comprehensive disease management, which could include those point of care tests and the preventative medical screenings, as well as immunization consultations.
Yeah. Now you did mention earlier about some of the things you were doing during the pandemic, but how has the pandemic impacted the services that you provide, and do you intend to continue those post-pandemic?
Yeah, the pandemic certainly impacted so much of what we do and how we manage our business. I think the most significant impact that we saw from the pandemic was, the need for the rapid rollout of our COVID-19 vaccination program. Mm-hmm. To better support our communities, to get on the other side of the pandemic. We we were able to rise to the occasion, and meet the need of this vaccination effort through our partnership in the federal retail pharmacy program. And that included having us implement an appointment-based scheduling system to support this, the vaccination effort. And ultimately, when the time was right, we were able to transition to a walk-in model to better support our patients in our communities. And I think, post-pandemic, we fully intend to leverage that scheduling tool moving forward to really support the various patient-facing services that we just spoke about, and provide those clinical services moving forward. And then I think, as we mentioned earlier, throughout the pandemic, it was very apparent that our patients were desiring more convenient access points to their pharmacy care. Whether that was through delivery or curbside pickup, or expanded options of pickup that we ultimately were able to offer. And certainly post-pandemic, we'll look to continue to provide these more convenient ways for our patients to access the critical services from our pharmacies, and really further cement our role as a premier health and wellness destination.
Yeah, I'm curious, with the increase in the Delta variant, have you noticed more appointments now for people getting vaccinations?
So we've been fortunate that even in the midst of the Delta variant, we've been able to sustain a walk-in model. So we're not requiring COVID-19 vaccination appointments. We have certainly seen an increase in the number of vaccinations that we've been providing as the Delta variant has really started to take more of a foothold throughout the nation. Certainly have been seeing some additional immunizations that we've been providing over the past month.
Yeah. Okay. So are there any plans to launch new initiatives for health and wellness in the future?
Yeah, our goal is always to be, surveying the landscape to identify opportunities to really drive positive patient outcomes. And so, we'll continually do that. And, that could include looking at, a robust telehealth offering, as well as really a nice expansion to our point of care testing program to support our communities and our healthcare prescribers in our communities. As well as integrating our pharmacy services together with our nutrition and disease management program that ultimately allows for a very comprehensive food and medication program for our patients that really helps to deliver positive benefits to their healthcare treatment.
Yeah. So the final question for you is: so what do you want our audience to know about Price Chopper that they probably don't know already?
Yeah, I think that we're Price Chopper Market 32. Our primary goal is to ensure that we're meeting the healthcare needs of our patients and our families that we serve. So that we are more than just a supermarket. We have a very robust offering of pharmacy services to provide to our communities. We very routinely collaborate and partner with health systems as well as payers within our communities to ultimately offer really targeted programs to ensure that our patients are getting the care that they need and are seeing the positive outcomes that they need to ensure management of their disease categories. So I think those are really the important pieces that probably we want patients to recognize and that we can offer those services, and that we're here to help. We're positioned nicely within our communities to be that healthcare destination, and our pharmacists and our pharmacy teams are positioned to really provide the support that our patients need.
Okay, great. Mr. Guisinger, thank you very much for talking to us.
Yeah, thanks for having me, Nigel. Really appreciate it.
Thank you.